Question 3. Consider what might account for a child's communication delay. For example, a 3-year-old versus a 16-year-old child. In addition to a basic diagnostic protocol, that is, receptive or expressive language, speech, voice, and hearing, what would you need to find out to help you plan an appropriate and comprehensive therapy protocol? So as I understand this question, it's asking about the cause of language delay in a young child versus an adolescent. In addition, it's asking what needs to be evaluated over and above a basic diagnostic protocol in order for us to plan appropriate and comprehensive therapy. So, regardless of age, there may be similarities in the reasons why both younger and older children might have a communication delay. We need to know this information in order to better evaluate the children and set up good communication plans. Communication delays may be caused by environmental factors or may be inherent to the child. We need to know, if possible, the cause of the delay itself and the extent to which the delay limits the child from functional participation in their required daily activities and how much it may affect them in the future. For example, a child may have a disability that affects their ability to think, an intellectual disability such as a developmental delay due to Down syndrome or autism, or something they're born with. They may also acquire such a condition, such as a traumatic brain injury or a high fever that causes swelling in the brain. Or there may be environmental factors such as perinatal drug abuse or exposure to lead-based paints, or the child living in a home where they're malnourished, abused, or neglected, or even given limited access to mainstream language or literacy due to the parents themselves not being educated or having come from a different country or using a less than standard dialect. A less standard dialect. The child might also have a sensory deficit, particularly one in hearing, that could be due to genetics, illness, or injury. Depending when this occurs, it can have different effects on a child's language. If the hearing loss is prelingual, such as in the case of a child born deaf, a young child will require extensive accommodations to be sure they can get full access to sound, or at least access to visual language that they can then transition into literate language. For children who lose hearing later, they're already pre-wired to have some understanding of phonology. In these cases, it's important to preserve the understanding they already have and help them generalize it to new information. Younger children, such as the 3-year-old in the example, are still learning to put together language. If they're identified early enough, we can maximize their access to language through the use of accommodations and extra language stimulation. They may or may not have more severe impairments as compared with older children, but remember their brains are more flexible and better at acquiring new knowledge because they're younger. We need to keep in mind these children's environments can be more controlled. They're living in a home environment, and we need to target our interventions to make sense for them functionally in their daily activities in the home. In the case of these children, we should target our activities to be in line with their interests, but the most important thing is getting them ready to progress down to skills that are developmentally normal, or more normal, so they can transition into preschool. Older children, on the other hand, such as the 16-year-old, are much more immersed in an academic situation, and they're using much more literate language. They're very close to transitioning to adulthood at this point. Assuming they're able to understand their needs, we really do have to keep their interests in mind so that they feel they're involved in the remediation. This helps with motivation. At this point, we need to focus on functionality of their basic skills and in helping them generalize what they already know so that they can do things independently at home, in school, and in the workplace, and if they're working or going to be working soon. Kids in this age group need to be weaned off very structured therapy, as they're just not going to have access to it for much longer, unless they have very severe disabilities, and even then, most of the therapy available will be directly aimed at improving their access to daily activities and functional social participation in their home environment, in a group setting.